the power of the placebo. That our belief can actually change how an intervention works. So if I have an essential oil, and I love essential oils, I'm already giving myself, you know, a star here or whatever. I'm giving myself an advantage was the word I was looking for, because I believe that that oil is going to do what I want it to do. And the cool thing is, biochemically, it does all these cool things, right? Changes our physiology, our psychology, our emotion, and our biochemistry all at once, because there's their aromatic influence, right? When I inhale, it goes to the emotional part of my brain, creating an instantaneous emotional shift. And then there's the constituents in the oil itself that are reacting with my neurobiology and my physiology, bringing balance and helping my body do different things on an enzymatic level, right? But if I combine that belief, now think about if someone said constantly, I'm so stressed, I'm so stressed, I'm so stressed, and they're feeding that into their nervous system. I'm so stressed, life is so stressful. What their body eventually is going to respond to, things are stressful here, I better keep up with these stress hormones. Now, what if they believe the opposite? Life's hard, but I'll get through it. I have resiliency. What are they feeding their nervous system? Okay, now let me pull this back into, that's more like mindset, let me pull this back into placebo, because they've done studies that show that our brain actually produces biochemical changes when we believe something will work, or if we don't work, that we're taking for a certain health symptom. And it's so powerful that randomized control studies control for this. Like, they have to actually have their drug more powerful than our belief that it won't work. How cool. Now, most doctors don't use this to their advantage. I always do. I will always say to my clients, like, do you believe this is going to work? Because if you don't, I'm 50% in trouble. Okay, so we want to make sure that the person is on board with what they're doing so that they can have optimal results. Now, there's different theories about the placebo effect, whether it's a psychological theory, like you expect something to work so it will, or biological theories. They've shown changes in dopamine and opioid pathways in the cholecystokinin, which is a messenger to your vagal nerve, which calms things down. They've seen changes in brain patterns on fMRIs for people that have had a placebo for pain. Actually, pain pathways have been modulated in the brain. It's really cool stuff. So it's more than just positive thinking. It's actually a merger of the mind and body. And even when people know that it's a placebo, it still works, which is cool. Like, you can say, take this placebo, and there's been studies that show that when you take a placebo, it's going to help you. So this might help your migraine. And they've done these open studies with migraines and IBS, and guess what? They got just as good results as with the intervention. So when all else fails, maybe take a sugar pill and tell yourself it's going to work, right? Not necessarily, but pretty cool, huh? We know that placebo, actually, the effect for some medications, what they found, especially with antidepressants, is when they did a study in antidepressant clinical trials, it was shown that the natural history of the disease, it's going to go away in about 24% of people anyways. And there's about a 25% drug effect, right? So some people really need it to modulate that serotonin in their brain or other neurotransmitters. And about expectations, 50.97% to be exact. So what you think in your subconscious thoughts lay dormant will ultimately determine the efficiency of your wellness. And then who you work with for your health will also determine your wellness, because the good physician treats the disease, the great physician treats the patient that has a disease. Who said that? William Alfler, right? So what they found in different studies is that patients are influenced by the trust they have in their practitioner and their interaction, and they'll actually get better results even with the same intervention, even if it's prescribed in the same way with someone they like. So you're better off going to a doctor that you like, or just staying away from your doctor when you're, no, I'm just kidding. But it is what they term the therapeutic effect, and they've done several studies on that and how the environment influences and the context and the doctor's credentials influence how well a treatment's going to work for someone. So if I told you I failed out all of my classes, which I didn't, and that I barely passed med school and that I've only seen a couple patients, you might not be as ready to accept my intervention or my essential oil than when I tell you, you know, I've been published, I've done research, I've worked with thousands of people, and I've gotten pretty cool results. So, so that is the power of the mind, the foundation of the health. So we're building on addressing the root cause. We're using this biology of belief, to steal that from Bruce Lipton. We're looking at how our mindset, or what we believe if we can grow or stay stagnant, is so important in health. Like if you believe that every symptom in your body is like this horrible, dangerous thing and you're just waiting to just explode, that's not a good thing. And the cool thing is, you can still work from that. You don't have to be scared of your thinking. You know that, and you can start to train it to be calm. And I actually will use biochemical interventions, neurotransmitters, essential oils, nutrients, supplements, to help somebody's nervous system calm down so they can train their thoughts a little bit easier to train those neural pathways. So actually, let's talk about that a little bit with the essential oils in the brain. So I already explored a little what aroma does in the emotional parts and the constituents themselves. So we know that essential oils affect neurotransmitters, brain functioning, how your brain waves actually move, and your biochemistry. So in vitro and in vivo, so we're talking animal studies, they've shown specific essential oils to modulate specific neurotransmitters. So for example, lavender affecting serotonin, lemon enhancing enhancing serotonin, suppressing dopamine. Now why would you want to suppress dopamine? Think about when somebody is overstimulated, over-reward, substance abuse kind of a thing. Bergamot has been shown to enhance synaptic connections, how the little neurotransmitters communicate. Bitter orange, another one for serotonin. So you're going to think of your citrus oils and serotonin, and then you think of the beneficial aspect of the whole synergism of the oils, not just one pathway. So we know, for example, rosemary has stimulating characteristics, and that benefits focus and memory. And jasmine has been shown on MRIs to help the body calm, but also stay focused. Peppermint has been shown to help with focus. There's just a bunch of oils, and I will leave those links in the video description. So wherever you're watching this, YouTube, my website, Facebook, you will have these to access and kind of look at all the ways that essential oils impact our emotional and physical health. And now, as a bonus, I didn't write about this on my blogs, but I wanted to include this in this video, and I know this is getting kind of long-winded here, so I'll wrap it up. But there are different documentations of what they call spontaneous remissions, and they've studied these. In fact, there was a 2021 paper that studied these spontaneous remissions in cancers, and they've come up with different thoughts about why this would occur. You know, as far as infection-mediated immune responses, like infections activating the ability to handle the cancer, disruptions in the microenvironment of the tumor. These can influence the tumor, quote, spontaneously remitting. Now, there's actually a doctor, and his name was Dr. Jeffrey Rediger, and he's an author of Cured, and he's a medical director at McLean, and also, I'm not sure, he teaches at Harvard Medical School as well. But what he's actually said that spontaneous remissions aren't as rare as you might think, in that the people who have these spontaneous remissions, it isn't usually related to just this biochemical shift, but they've made radical changes in their lives, like to change the way that they've eaten. They've changed their daily habits, exercise routines, doing things they may that make them feel good. They ditched careers or relationships that were holding them back. They addressed their stress response. They ended in damaging cycles of fight or flight and stress of corroding their system. And they finally asked themselves an important question of, what do I want to do with the time I have left? And who do I want to be? What's my purpose? And they examined their deep-seated beliefs. And these were the things that they were found to have in common, he said. And then there was a cancer survivor, Glenn Sabin, he said he's in remission at this point, who says spontaneous remission is a myth. It's radical remissions that are real. And it talked about Kelly A. Turner's book about cancer survivals, and she said there's 9 factors for the people that have experienced radical remission. Diet, taking control, these empowerment of your own health, following their intuition, using herbs and supplements, releasing suppressed emotions, increasing positive emotions, embracing social support, deepening spiritual connection, and having a strong reason for living. And I want you to kind of think about that. Think about people that you know that may have overcome this diagnosis or lived longer than they were supposed to. What characteristics were common for them? And what characteristics do you see in people that are chronically ill, right? What characteristics, maybe if you look within yourself, do you have that you know might be holding you back? So I want you to explore that. I want you to realize there's more to health than fearful messages and just waiting for your body to degenerate so that you can suppress the symptoms. Way more. And there's a promise for that. And so make a commitment to do a mindset shift. Maybe look into some integrative philosophies and practitioners such as myself or other functional or naturopathic doctors that you resonate with, because that therapeutic relationship is imperative. And get on a journey to empower yourself, to start living your life, because to me, health isn't the end game. To me, health is getting your body to a place where you don't even feel it, so that you can do what you are going to do and go out and crush life and spend time with the family and your friends and the people that you love the most, uninhibited by fears of your body or your health. Cool? All right. I will be back. Thank you for listening, and I really do look forward to your feedback. Have a great one, and take gentle care.